The journey through our senior years brings a heightened awareness of our body's intricate systems. Among the most vital, yet often overlooked, are the kidneys. These two bean-shaped organs are the body's master filtration plant, working tirelessly day and night to remove waste products, balance bodily fluids, regulate blood pressure, and produce essential hormones. As we age, the natural efficiency of our kidneys can decline, making it more crucial than ever to adopt supportive lifestyle habits. The concept of cleansing the kidneys isn't about a harsh, aggressive detox, but rather about providing them with the right nutrients and hydration to perform their functions optimally and reduce their burden. What we consume in the quiet hours before sleep can have a profound impact. During the night, our body enters a state of repair and regeneration. Providing it with gentle, kidney-supportive fluids can aid this process significantly. The following 5 beverages are not magic potions, but they are backed by both traditional wisdom and modern nutritional science for their beneficial properties. They are simple to prepare and can be a comforting and healthful end-of-day ritual. 1. Warm lemon and ginger water, the gentle flush. This classic combination is revered in wellness circles for a reason. It's a simple, powerful duo that offers a multitude of benefits, particularly for kidney support in older adults. The science of support. Lemons are rich in citrate, a natural compound that is a potent inhibitor of calcium oxalate crystal formation. These crystals are the most common component of kidney stones. By increasing urinary citrate levels, regular consumption of lemon water can help prevent stones from forming and may even help break down very small existing ones. Ginger is a celebrated anti-inflammatory and antioxidant powerhouse. Chronic inflammation is a key driver of many age-related diseases, including chronic kidney disease, CKD. The active compound in ginger, gingerol, helps to quell inflammation throughout the body, reducing stress on the kidneys and protecting their delicate filtering units, nephrons, from oxidative damage. Benefits for seniors. Beyond kidney health, this drink offers collateral benefits ideal for seniors. The warmth of the water combined with ginger's properties can soothe the digestive system, preventing indigestion or acid reflux that might disturb sleep. Ginger is also known to help with nausea and improve circulation. Simple preparation. Boil a cup of filtered water and let it cool slightly to a warm, drinkable temperature. Squeeze the juice of half a fresh lemon into the mug. Add 2 to 3 thin slices of fresh ginger root, or 1/4 teaspoon of ground ginger. Stir well. A tiny dash of raw honey can be added for taste, but it's best to keep it minimal. Important considerations. For seniors with GERD, gastroesophageal reflux disease, the acidity of lemon might be an issue. It's wise to start with a smaller amount of lemon juice to see how the body reacts. Ginger can have a mild blood-thinning effect, so individuals on anticoagulant medications like warfarin should consult their doctor before making this a daily habit. 2. Unsweetened cranberry juice. The protective shield. Cranberry juice has a long-standing reputation for urinary tract health, and this benefit extends directly to protecting the kidneys. The science of support. The primary threat to the urinary system, which can ascend to the kidneys, is bacterial infection. Urinary tract infections, UTIs, if left untreated, can lead to a serious kidney infection called pyelonephritis. Cranberries contain unique compounds called A-type proanthocyanidins, PACs. These PACs have a remarkable anti-adhesion property. They prevent bacteria, particularly E. coli, from sticking to the walls of the bladder and urethra. By flushing these bacteria out before they can establish an infection, cranberries act as a protective shield for the entire urinary tract. Benefits for seniors. Seniors are more susceptible to UTIs due to various factors, including changes in the immune system, bladder emptying issues, and catheter use. A nightly glass of pure cranberry juice can be a powerful preventative measure. It's also rich in vitamin C and other antioxidants that support overall immune function. Simple preparation. It is absolutely critical to choose the right kind of juice. Select 100% pure, unsweetened cranberry juice, not the cranberry cocktail varieties which are loaded with sugar and water. Because pure cranberry juice is very tart, dilute a small amount, e.g., 30 to 60 milliliters or 2 to 4 tablespoons in a full glass of water. Drink this diluted mixture. Important considerations. The high sugar content in most commercial cranberry drinks is counterproductive and harmful. Always read the label. For those with a history of oxalate kidney stones, it's worth noting that cranberries do contain oxalates, so moderation is key. Consulting a healthcare provider is recommended in this case. 3. Turmeric golden milk, the anti-inflammatory soother. This comforting, warm beverage is a cornerstone of Ayurvedic medicine, prized for its profound anti-inflammatory effects. The science of support. The star of this drink is curcumin, the active ingredient in turmeric. Curcumin is one of the most powerful natural anti-inflammatory agents ever studied. It works by blocking multiple inflammatory pathways in the body at the molecular level. For the kidneys, this means reducing the chronic, low-grade inflammation that can damage the delicate blood vessels and filtering structures over time. Studies have suggested that curcumin may help slow the progression of chronic kidney disease by mitigating fibrosis, scarring, and reducing proteinuria, excess protein in the urine, a key marker of kidney damage. Benefits for seniors. Inflammation is the root cause of many ailments that affect seniors, most notably arthritis. A nightly cup of golden milk can help soothe joint pain and stiffness, promoting more restful sleep. It's a caffeine-free, comforting beverage that calms the mind and body. Simple preparation. Gently warm 1 cup of milk, dairy, or an unsweetened plant-based alternative like almond or coconut milk in a saucepan. Do not boil. Whisk in 1/2 teaspoon of ground turmeric, 1/4 teaspoon of ground cinnamon, and a pinch of black pepper. The piperine in black pepper is essential as it increases the bioavailability of curcumin by up to 2,000%. A small slice of ginger can be added for extra benefits. Pour into a mug and enjoy warm. Important considerations. Like ginger, turmeric has blood-thinning properties. Seniors on anticoagulant medication must speak with their doctor. High doses of turmeric can also cause stomach upset in some individuals. Start with a smaller amount. Dandelion, rotea. The gentle diuretic, often dismissed as a common weed. Dandelion is a historically significant medicinal herb, particularly valued for its effects on the liver and kidneys. The science of support. Dandelion acts as a natural diuretic. This means it helps the kidneys produce more urine, which in turn helps to flush out excess salt, waste products, and retained water from the body. Unlike some pharmaceutical diuretics that can deplete potassium, dandelion is naturally rich in this mineral, helping to maintain a healthy electrolyte balance. It also stimulates bile production, which aids in digestion and fat processing, indirectly reducing the workload on the kidneys. Benefits for seniors. Mild fluid retention, edema, often seen as swollen ankles, can be a common issue in older adults. A gentle diuretic like dandelion tea before bed can help alleviate this overnight. It's a caffeine-free alternative to other teas and can be very calming. Simple preparation. You can use either pre-made dandelion root tea bags or 1 to 2 teaspoons of dried, roasted dandelion root. Steep the tea bag or loose root in a cup of hot water for 5 to 10 minutes. Strain if using loose root. Drink plain. Important considerations. Because it is a diuretic, it may cause an extra trip to the bathroom at night. It's best to drink it about 60 to 90 minutes before lying down for sleep. Individuals with allergies to ragweed and related plants may have a reaction to dandelion. 5. Parsley water or tea. The nutrient-rich flusher. More than just a garnish, parsley is a nutrient-dense herb with impressive diuretic and antioxidant properties. The science of support. Parsley is rich in antioxidants like flavonoids, carotenoids, and vitamin C, which help protect the kidneys from free radical damage. It is also a known natural diuretic, aiding in the flushing of toxins and reducing water retention. Some studies have suggested that parsley can help reduce the buildup of calcium oxalate deposits in the kidneys. Furthermore, It contains compounds like apiol and myristicin that have been shown to stimulate urine flow. Benefits for seniors. This is a very gentle and inexpensive way to support kidney function. Its high vitamin K content is also beneficial for bone health, a key concern for the elderly. Simple preparation. Thoroughly wash a small handful of fresh parsley, about a quarter cup. Chop it roughly and place in a mug. Pour 1 cup of hot, not boiling, water over the parsley. Let steep for 5 to 8 minutes. Strain the leaves out and drink the warm water. A squeeze of lemon can be added. Important considerations. Parsley is very high in vitamin K, which can interfere with blood-thinning medications like warfarin. It is absolutely essential for anyone on these medications to avoid parsley tea or consult their doctor. It is also high in oxalates, so it should be consumed in moderation by those with a history of kidney stones. Point 1. Sugary beverages, the sweet poison. This category is the #1 enemy of metabolic and kidney health. It includes a wide range of popular drinks, sodas like cola and lemonade, sweetened fruit juices, iced teas loaded with sugar, and energy drinks. The science of harm. The primary culprit here is high fructose corn syrup, HFCS, or refined sugar. When consumed in liquid form, this sugar is rapidly absorbed into the bloodstream, causing a sharp spike in blood glucose levels. To manage this, the pancreas releases insulin. Over time, this cycle can lead to insulin resistance, metabolic syndrome, and eventually type 2 diabetes. Diabetes is the leading cause of chronic kidney disease and kidney failure worldwide. High blood sugar directly damages the tiny, delicate blood vessels in the kidneys, impairing their ability to filter blood effectively. Furthermore, the metabolism of fructose significantly increases the production of uric acid in the body. High uric acid levels are a risk factor for both gout, a painful form of arthritis common in seniors, and the formation of uric acid kidney stones. The phosphoric acid found in many dark colas has also been linked to an increased risk of kidney stones and a faster progression of kidney disease. Specific risks for seniors. An elderly person's ability to manage blood sugar is often less efficient. A pre-sleep sugar bomb can disrupt sleep patterns, contribute to weight gain, particularly abdominal fat, which is highly inflammatory, and place immense stress on already vulnerable kidneys. Many seniors are already managing diabetes or prediabetes, and these drinks actively work against their health goals. Even diet sodas containing artificial sweeteners are not a safe alternative, as some studies have linked their long-term consumption to a decline in kidney function. The verdict: there is no safe amount of sugary soda or juice before bed. These drinks offer zero nutritional value and actively contribute to the very diseases that lead to kidney failure. They should be eliminated from the diet, especially in the evening. 2. Alcohol, the dehydrating toxin. While a nightcap may be a long-standing tradition for some, regular alcohol consumption, particularly before sleep, is a significant burden on the body's filtration systems. The science of harm. Alcohol is a diuretic, but not in a beneficial way like dandelion tea. It suppresses the production of a hormone called vasopressin, which tells the kidneys to reabsorb water back into the body. Without this signal, the kidneys excrete more water than they should, leading to dehydration. Chronic dehydration is a major risk factor for acute kidney injury and the formation of kidney stones because it concentrates waste products in the urine. The liver is the primary organ responsible for metabolizing alcohol, but the kidneys play a crucial supporting role in filtering it from the blood. Heavy or regular drinking forces the kidneys to work harder, altering their structure and function. It can also increase blood pressure, which is the second leading cause of kidney failure. For seniors, whose kidney function is already declining at a natural rate of about 1% per year after age 40, this added strain can accelerate the decline significantly. Specific risks for seniors. Seniors are more sensitive to the effects of alcohol due to a lower percentage of body water. It can lead to dizziness, falls, and injuries. Crucially, alcohol interacts dangerously with a vast number of medications commonly taken by older adults, including those for blood pressure, pain, and sleep disorders. Consuming alcohol disrupts the natural sleep cycle, preventing the deep, restorative sleep that is essential for physical and mental repair. The verdict: a glass of wine with dinner occasionally may be acceptable for healthy individuals with a doctor's approval, but any alcohol in the hours leading up to sleep is detrimental. It dehydrates the body, strains the kidneys, and disrupts the essential restorative processes of sleep. 3. Caffeinated drinks, the misguided stimulant. This category includes coffee, black tea, green tea. Despite its health benefits, it contains caffeine and some sodas. While these may be perfectly fine earlier in the day, they are a poor choice before bed. The science of harm. Caffeine is a stimulant that works by blocking adenosine, a neurotransmitter that promotes relaxation and sleepiness. Consuming it in the evening directly interferes with sleep onset and quality. Poor sleep is linked to a host of health problems, including high blood pressure and diabetes, both of which are major risk factors for kidney disease. Like alcohol, caffeine is also a mild diuretic. While a single cup is unlikely to cause significant dehydration, making it a nightly habit can contribute to a chronic state of suboptimal hydration, increasing the concentration of minerals in the urine and raising the risk of kidney stone formation. For the kidneys to effectively filter waste products overnight, they require adequate hydration, and caffeine works against this goal. Furthermore, some studies suggest that very high caffeine intake may slightly increase blood pressure and put a mild, temporary strain on the kidneys. Specific risks for seniors. Sleep patterns naturally change with age, often becoming lighter and more fragmented. Adding caffeine to the mix can exacerbate insomnia and lead to next-day fatigue, creating a vicious cycle of needing stimulants to function. Many blood pressure medications are designed to work over a 24-hour period, and the stimulating effect of caffeine can work against their intended purpose. The verdict: all sources of caffeine should be avoided for at least 6 to 8 hours before bedtime. If a warm, comforting tea is desired, it is essential to choose a naturally caffeine-free herbal option, such as chamomile, peppermint, or the kidney-supportive choices mentioned in Part 1. Conclusion and in-depth explanation. Supporting a system, not flushing it. The concept of a kidney cleanse can be misleading. It often conjures images of flushing out toxins, as one might clean a pipe. However, the reality of kidney health is far more sophisticated. Our kidneys are not passive filters. They're dynamic, intelligent organs that perform a constant, complex balancing act. The most effective way to cleanse them is not through an aggressive, short-term detox, but through consistent, long-term support that reduces their workload and provides the raw materials they need to function optimally. The deeper mechanism. The drinks to embrace, like warm lemon water, turmeric milk, and dandelion tea, work by providing 4 key elements. Hydration. Water is the fundamental vehicle for the kidneys to excrete waste products like urea and creatinine. Anti-inflammatory compounds. Agents like curcumin and gingerol combat the low-grade, chronic inflammation that silently damages the nephrons, the kidney's microscopic filtering units, over years. Antioxidants. Compounds in parsley, lemon, and cranberries neutralize oxidative stress from free radicals, protecting the delicate kidney tissues from cellular damage. Specific inhibitors. Citrate from lemons and proanthocyanidins from cranberries directly interfere with the formation of kidney stones and bacterial infections, respectively, preventing common kidney-related problems before they start.